Welcome to Pod Operations Training Assessment. This training will cover the positions and job duties of the staff and volunteers who will be working in the assessment area. Please pay close attention to the information and instructions you are about to receive. At the end of this video, you'll be given additional instructions by your supervisor. Again, we thank you for your willingness to serve in this public health response. As you may recall, assessment is the second stage in the four-stage POD process. Here, the client's medical form will be reviewed to determine which medications or vaccinations to give the client and their household members. Let's find out a little more about the assessment team and how it fits within the overall POD operation. Typically, the key positions in assessment are assessment nurse and assessment pharmacist. Depending on the scope of the incident and size of the pod, there may be additional positions. As a member of the assessment team, you will report directly to the medical supervisor. If you are an assessment nurse, you'll be responsible for taking the medical form from the client and determining which medications or vaccines to give the persons who are listed on the form. In order to make that determination, you may need to consult with the assessment pharmacist regarding any potential drug interactions. If a more extensive review or medical history is required to make the determination, you may need to send the client to medical evaluation. When receiving the form, you will want to pay particular attention to any allergies or pre-existing medical conditions listed for each person on the form. Please mark the correct medication to dispense to each person on the form based on the guidelines you will be given by the medical officer or assessment pharmacist. You will then print and sign your name on the medical form to indicate that you have reviewed it. Once you have marked the medications for all persons listed on the form and signed your name, you'll return the form to the client. Then you will direct the client to proceed to the next stage of the process, dispensing. Be sure to ask the client if they have any questions. Try to be as brief as possible so that you can keep the lines moving. Let them know that they'll be receiving an information sheet about the medication at the next station. Remember, the purpose of a pod is to get as many people the necessary medication or vaccine as quickly as possible. While speed is important to the process, the assessment nurse needs to be very thorough in assigning medication. Again, you may need to consult with the assessment pharmacist for any potential contraindications. Clients with complex medical issues can also be sent to medical evaluation. Most likely, there will be a radio assigned to the assessment area, and you will be given instructions on how to use it. If you get low on supplies or have any other issues or problems, contact a supervisor. If at any point you feel a client is having any medical or mental difficulties, you can have them escorted to the acute care area for further evaluation. If you are an assessment pharmacist, you will be responsible for checking any potential drug interactions between the medications the client is already taking and the ones being dispensed at the pod. This will only need to occur when you are asked to do so by the assessment nurse. For example, in an anthrax event, you might be checking to see if a client who is taking medication for diabetes should be given doxycycline or ciprofloxacin. You will then make a recommendation to the assessment nurse or acute care nurse on which of the medications would be appropriate for the patient or if none are appropriate. You will be provided with the tools such as a laptop computer and internet connection needed to perform these duties. If you have any issues or problems, notify the medical supervisor. As a member of the assessment team, you play an important role in the overall pod operation. Remember, you will be deciding which medications or vaccines to give the client and their family members. Please be polite and professional when speaking with clients and staff. Remember, too, that a public health emergency can be stressful, and some people may have a hard time coping with their anxiety or fear. Speak to them in a calm and soothing voice and offer to get them assistance if needed. Always ask the client if there are any questions you can answer. Mental health professionals and translators may be available if needed. If you encounter any issues or problems, please notify a supervisor or ask for assistance from a member of the safety or security team. Thank you for your time and attention. You will now report to the assessment area for some further instructions.